Welcome to the Affordable Care Act presented by the Green Team. So what is the Affordable Care Act? The Affordable Care Act was signed into law by President Barack Obama in March 2010. The three primary goals of the Affordable Care Act include ensuring more people have health insurance, expanding the Medicaid program, and supporting the innovative medical care delivery methods designed to lower the healthcare cost. And here, as you can see, is a timeline from 2010 until 2020. Here is just a diagram of the impact of the Affordable Care Act. As you can see here, seniors make up about 13% of the population, but account for 30% of healthcare spending. Prescription drugs are responsible for about 10% of all healthcare spending in the United States. The United States is the only wealthy industrialized country without universal healthcare. The United States also spends more than 17% of its total GDP on healthcare, the highest percentage of any country in the world. More than 17 million Medicaid expansion enrollees. And as of February 2019, 9.3 million enrollees received premium tax credits and 5.5 million received cost-sharing reductions. 2.3 million young adults up to the age of 26 are covered under the Affordable Care Act. 26 insurers are entering state marketplace for the year 2020. 54 million people with pre-existing conditions are covered, and over 5 billion health care cost has been reduced from 2012 to 2019. What is the status of those who are newly covered? Since the Affordable Care Act, fewer people today are uninsured. However, more people are underinsured. And here you'll see a graph dating from 2003 to 2018 with the adults between the ages of 19 to 64. In 2018, an estimated 87 million, which is about 45% of the 194 million United States adults between the ages of 19 and 64 were inadequately insured. 44 million people who were insured throughout 2018 were underinsured because of high out-of-pocket costs and deductibles. More adults are underinsured, with the greatest growth occurring amongst employer coverage. Fewer adults also have difficulty paying their medical bills, but this improvement has stalled. What are exchanges? Another term for the health insurance marketplace, a service that helps individuals to shop, enroll, and compare health insurance. Exchanges create more efficient and competitive markets for enrollees by reducing transaction costs and increasing transparency. Some of the requirements for exchanges include providing enrollee health insurance portal, standardized plan options, electronic resources, and call center support. Determine eligibility for and enroll applicants in public programs. Determine eligibility for new tax credits and cost-sharing reductions. And report user and employer data to the Department of Treasury. The Maryland Health Insurance Marketplace Exchange was signed into law in April 2011, with additional legislation passed in May of 2012. Care First, both HMO and PPO entities, and Kaiser offer health plans in 2020. United Healthcare plans will join in the year 2021. Premiums decreased by an average of 13% in 2019 and an additional 10% in 2020. The enrollment increased by 2% in 2019. The District of Columbia Health Insurance Marketplace Exchange is available through DC Health Link. There is no option to select an off-exchange plan. 2020 rates and plans have increased by an average of 7.6%, and more than 18,000 people enrolled for 2019 and down from more than 22,000 people enrolled in 2016. Pregnancy has now become a qualifying event in the District of Columbia. What does the Medicaid program have to do with the Affordable Care Act? The Affordable Care Act expands Medicaid to all Americans with income at or below 133% of federal poverty guidelines by January 1st, 2014. To date, 38 states have adopted the Medicaid expansion. Study outcomes into three broad categories: coverage, access, and economic measures. Study indicates that the expansion is linked to gains in coverage, improvements in access, financial security, and some measures of health status and economic benefit for states and providers. How have health insurance premiums been affected? The Affordable Care Act dramatically expanded Medicaid coverage for low-income Americans. The studies show from 2010 to 2017, the Affordable Care Act reduced healthcare spending at a total of $2.3 trillion. Employer-sponsored insurance, for example, averaged premiums almost $1,000 less per person and $4,000 less for all insured families. What variables are in play in the political debate over the impact of the Affordable Care Act on costs, access, and quality of care? One of the arguments that the Affordable Care Act does not increase healthcare access. However, one of the studies proved otherwise. Newly insured patients are less likely to report being unable to access healthcare or delaying because of costs. The Affordable Care Act lowered healthcare costs and premiums, and as a result, costing $24 billion less than originally expected. However, some may argue that the law does not do much to lower prescription drug prices, which can increase healthcare costs. The Affordable Care Act had a huge impact expanding quality-based reimbursement and public reporting. Beginning in 2017, Congress and Trump administration reduced the federal government's role in setting standards in operation, such as eliminating tax penalty for not having coverage. Some key challenges facing state and national policymakers. Some pre-existing conditions that cover continuation. There's a loss in revenue directly related to increased costs to cover pre-existing medical conditions. Insurance companies reporting high financial losses due to a rise in the number of enrollees with conditions like hypertension, diabetes, depression, coronary artery disease, HIV, and hepatitis C. New programs such as Universal Access Program aimed at improving high-risk pools and reinsurance programs have a substantial price tag of $25 billion. Patient Care Act includes continuous coverage and prevents the denial of anyone with a pre-existing medical condition to be charged a higher premium if they can prove prior coverage to diagnosis. How to improve cost savings and expand coverage. Improving price transparency with provider network results in payers assisting their consumers in choosing the least expensive quality healthcare option for services such as x-rays, medical testing, and specialty providers. Revision of the Supreme Court ruling which allowed optional expansion of Medicaid coverage. Revoking the option to expand coverage will add buy-in from 19 states that elected not to expand Medicaid programs. The dismissal of expansion causes disparities in access, care prevention, and reduction in coverage options. States will be challenged with making the decision to increase expansion of Medicaid and potentially repercussions of the decline of population health and access to care. The Affordable Care Act is a good law, and here's why. The reduction of Medicare payments by $335 billion, which is a 21% reduction of Medicare payment rates, creating a streamlined payment rate for covered services by providers. Additional charges to drug companies with a net of $107 billion, a collapse of the donut hole. Imposed excise tax on high premium insurance plans, 40% excise on high-end health insurance plans. Tax on high-income families adds $210 billion. Capital gains are raised on 5 million high-income families, which equates to 2.35% in Medicare income taxes, an increase up from the 1.45% reported prior to the enactment of the Affordable Care Act. Education savings of $19 billion, eliminating Sallie Mae as the middleman providing federal funding. Instead, the Department of Education lends funds directly to students. The Affordable Care Act introduced a standardized approach to improving health outcomes with a focus on safety and quality of care delivered, prompting the healthcare industry to shift its focus and place the patient at the center of care. Through the Affordable Care Act, we have witnessed many positive outcomes, such as the patient-centered home, HCAPS, and CGCHAPS, which all help to improve the delivery care model and improve efficiency. The Affordable Care Act has also reduced the budget deficit by $143 billion between 2010 and 2019. Cost savings accredited to shaping preventive treatment for healthcare affordable for 33 million who had no coverage prior to the bill. The Affordable Care Act also saved Medicare prescription drug costs by collapsing the donut hole, coverage gap in Medicare Plan D prescription drug plans that also required higher out-of-pocket costs to Medicare recipients. Thank you.